cardiovascular diseases are heart and blood vessel diseases, many of which are related to a process called atherothrombosis. The cause of atherothrombosis is the buildup of plaque in the walls of the blood vessels, which eventually forms a blood clot, blocking the flow of blood, leading to a heart attack or stroke. Thrombosis is the leading cause of death in the industrialized world. The current treatment of atherothrombosis involves the use of antiplatelet drugs. These drugs work by interfering with the functions of platelets. In doing so, side effects such as bleeding arises because of the loss in the platelets' function in hemostasis. My question is it possible to develop a medicine which can inhibit thrombosis without affecting the functions of platelets? By investigating the composition of coral, I found out that it contains abundance of prostaglandin, particularly PGE1. With help of an optical platelet aggregometer, I was able to examine whether PGE1 can act as an antithrombotic agent. The results were positive. PGE1 was successfully able to inhibit ADP-induced aggregation, but it was not successful in inhibiting collagen and arachidonic acid-induced aggregation. The inhibition of receptors, collagen and arachidonic acid by drugs like aspirin in reducing platelet aggregation is the reason behind side effects such as bleeding. Prostaglandin, on the other hand, inhibits ADP-induced aggregation but doesn't affect collagen and arachidonic acid-induced aggregation, thereby not disturbing hemostasis. This research proves the potential of prostaglandin PGE1 in the inhibition of platelet aggregation compared to drugs like aspirin. This can overcome the current problems faced in drugs used for the treatment of atherothrombosis, such as bleeding, which can help combat atherothrombosis to great extents.